Hi everyone, and welcome to tonight's presentation, Natural Remedies for Our Kids' Health. My name's Peter Mullen from Mullen Natural Health Centre. We're a naturopathic practice here in Newcastle, and this was originally going to be an in-house seminar, but due to the current situation with the coronavirus, we thought it was probably a bit easier this time to have a go at actually doing this as a online event. Now, normally it's interaction, you'd have an opportunity to ask me questions as we went. However, there will be a link below this, so if you do have any questions, please let me know. So, as I said, we're a naturopathic practice in Newcastle. I have 5 other naturopaths as well as myself. Tonight's presentation is all about kids' health, but we deal with a wide range of health conditions. We all each have our own specialities, from fertility and natural conception through to cancer support, autoimmune conditions, gut health. So if you or a family member have any health issues, I'm sure that one of our practices would be able to help. As a special offer tonight, if you haven't been in before, if your child hasn't been in to see us before, we are offering $30 off an initial consult. So again, if you'd like to take advantage of that, contact us below and someone can return your call. A big part of what we do, a big part of what I'm really passionate about is education. That's why we originally put these talks together. And we generally have a big talk every month. We cover kids' health, which is one of my passions. We do a really great talk on stress and anxiety, gut health, and fermenting, weight loss, so thyroid. So we do a lot of talks through the year. So if you haven't been to one of our talks, or this is your first, please keep an eye out for other talks. And get involved, join us on Facebook and Instagram and all that sort of stuff as well. And tonight in my talk, I will be offering you education about natural remedies and lifestyle factors. I'll hopefully open your eyes to some other contributing factors to your children's or kids' health, and hopefully prompt you to ask some questions yourself about, one of the things I've noticed is that our kids' health is definitely not what it used to be. So as the night progresses, have a bit of a think about why you think that might be. What I will not do tonight is I will not prescribe medications, I will not diagnose any health conditions, and unfortunately I won't be doing any dancing. Normally I do at a live event, but not tonight. So one thing that's really important is that every child comes with their own unique individual self, their own individual experiences. They're all at different levels, academically, physically, emotionally, mentally, and they give us clues. So, the way our kids behave, how often they get sick, in some respects is their little body's way of telling us that something's out of balance. What we don't do is try and compare every child and say every child should be at this age, at this milestone. We really take an individualistic approach when looking at your kids' health, as I'm sure you do as parents as well. ADD, ADHD, autism, anxious, depressed, easily distracted. These are some of the health conditions that we're seeing more and more of with our kids. And even things like birth complications. Was your child bottle fed? Did they suffer from reflux or colic? Are they a terrible sleeper? History of antibiotics? Have they had reactions to vaccinations? Getting sick all the time, asthma, eczema, sinus, ear infections, tonsillitis, digestive problems. So basically, if you've answered yes to any one of those previous conditions, you're in the right place. Tonight I'll be talking with you about what I believe is happening with our kids' health, about our microbiome, this concept of good and bad gut bugs, and how much our microbiome, how much the research is suggesting that our gut health really does play a big role in our kids' health, in our health as adults as well. What I consider to be the 6 most prominent underlying causes of why our kids can have health concerns, and some awesome natural medicines for our kids' health. And tonight, particularly, I'll be talking or focusing a lot about immune situations, given the current virus as well, ways that you can really safeguard or boost the immunity of not only your kids but the whole family as well. So we'll have a bit of an inflection more towards immune boosting. So the 2 key points I hope that you guys get from coming tonight, number 1 is the importance of our kids having a healthy gut. And number two, this connection between the gut, our immune system, and our nervous system or brain, which I'll talk at length about as we go. So what is happening with our kids' health? Now, I'm sure you'll all agree that our kids' health is not what it used to be. When we were kids, I don't think I knew anyone that had an asthma puffer. We didn't have all these nut-free schools and egg-free schools, etc., etc. Autism was so rare, I don't think I knew anyone that had been diagnosed as autistic. And, I'm 54, so this is only maybe 40 years ago, which is a scary thought just in itself. But something's definitely happening. Our kids' health is not what it used to be. Behavioural and learning disorders are on the increase. Up to 20% of our kids, or 1 in 5 kids, have been diagnosed with a learning or behavioural disorder. Asthma has doubled in the past 25 years, or 20 years rather, with 35% of our kids now being diagnosed as having asthma. Allergies are increasing, as I was saying, these nut-free schools, egg-free schools, and the average number of colds per year for your child has been estimated to be 5 to 10 times per year. So I remember when we were kids, you definitely didn't get sick that many times. And the stress this creates in our community, you imagine if your child's sick 10 times a year, and each time they're out of school or out of action for 1 to 2 weeks, and mum's got to take time off work or you've got to get care, that's a lot of extra cost, time, and emotional stress and strain on everybody. So something's going on. Increased incidence of ear infection, 80% of our kids by the age of 3. Australian children are 25% now overweight. Rise in leukemia, juvenile diabetes, and brain tumours. And when we think about it, Panadol is one of the top 10 most prescribed medications for our kids. Repeated courses of antibiotics, antihistamines, asthma medications, antidepressants, anti-anxiety medications, and medications like Ritalin. What we're finding is that with this massive increase in us prescribing these medications, or our kids being prescribed these medications, and yet our kids' health still is not improving. So my goal, or my thoughts are that if we're taking a medicine, it should be to improve our whole health. But that doesn't seem to be the case with this current orthodox approach. Dramatic rise in autism over the last 20 years. Some stats, or one report I was reading was suggesting by the year 2050 that 1 in 2 kids, particularly 1 in 2 boys, will be diagnosed as being autistic. I don't believe those stats. I'm hoping to be a lot more optimistic, but this rapid increase is definitely getting out of control. Now, with this increase in autism, they're saying that, maybe better diagnosis accounts for 1/3 of this increase. So we've had a 600% increase, and this is only up to 2001. 200% non-environmental factors, age of inclusion, maybe better diagnosis, but the rest, 400% of this increase has been put down to or contributed to by environmental contributors. And when I sort of think of the kids' health or health in general, I like this analogy of the iceberg. Above the water we've got the tip of the iceberg, but it's below the water where a lot of the issues are. And some of these issues are concepts like preconception, pregnancy and birth. Now I'll go through a couple of these as we go, and then there's 6 that I'm going to focus on a bit more in detail. Breastfeeding, introduction of solids, leaky gut, food allergy and intolerance, additives and preservatives, nutritional deficiencies, genetic polymorphisms, heavy metal toxicity, and and above the line we're seeing eczema, asthma, behavioural problems, sleep issues, autism, etc. So imagine the conditions are listed across the top. Somehow that list seems to have slipped off my slide, but it's underneath the water is where we're seeing the causes. Now, I'll talk with you just briefly about preconception, pregnancy and birth. Our kids' health, and one of the reasons why I believe that our children's immune system is not what it used to be, is because of this change in microbiome. Our gut flora is totally different to what it was 100 years ago. And if you think about where your child develop their gut flora, their microbiome, it was from the birth process. So basically your child got its initial contact with gut flora through the birth process, hopefully through a natural birth. As the baby came through the birth canal, it got inoculated with mum's natural bacteria, and that started the process of setting up the child's gut flora. One of the reasons why I think we're seeing such an issue with kids' health is that this generational transfer of the microbiome from mother to baby probably goes back 3 generations. So mum's mum, and mum's mum. So 3 generations has contributed to your child's microbiome, and what we've seen over those last 3 generations, an increase in things like the oral contraceptive use, cigarettes, alcohol. The last 50 years we've seen more toxins released into our environment than ever before. Stress of mums working. So there's been a whole host of things that I think have contributed to why mums' microbiomes have been affected, and I think that change has sort of been transferred down to our kids, and I think that's why our kids' immune systems are so much more reactive. So preconception, with the work we do with fertility, we believe that the health of mum and dad even prior to conception plays a big role in your child's health as well. Even mum being replete in or having good levels of vitamin D, fish oil, getting on a good probiotic even prior to the birth seems to play a role in whether our kids' immune systems are more stable or not. Breastfeeding, introduction of solids, all of these things contribute to our kids' gut health. And then I'm going to go into these down the side in a bit more detail as we go. So this is a concept that I'm sure a lot of you are familiar with, this concept of our gut-brain immune axis. And the theory is, and this relates back to probably one of the first things we'll talk about here, which is leaky gut. This relates back to when the gut wall becomes irritated or inflamed, and this can be through the history of antibiotic use, through eating too much gluten, having food allergy or food intolerances, additives or preservatives. Our gut wall can become inflamed, the cells or the gaps between the cells open up, and what we find now is toxins from our gut cross into the bloodstream and the immune system gets triggered. These inflammatory compounds can travel around the body and end up actually in the brain and affecting the brain and the nervous system. So we've got this connection between the gut, immune activation, brain and nervous system inflammation. And antibiotics are something that's a big cause of why we develop gut wall inflammation. An average child is prescribed antibiotics 10 to 20 times by the age of 18. Antibiotics for sure are sometimes necessary, they save lives, but we should never use antibiotics to treat viral infections. We should really reserve antibiotics for really serious health conditions. The microbiome may never recover from these changes, and this may contribute to increased risk of many diseases. A 2015 report in the UK said that antibiotic resistance will have killed 300 million people, with the annual global death toll reaching 10 million. So this overuse of antibiotics is going to really be a big problem in the future. And as I said, antibiotics are a big contributing to this concept of leaky gut. So as I mentioned before, we get inflammation of the gut wall, toxins and food particles enter the bloodstream, immune system responds, and our brain is affected. So leaky gut is a common thing I see with a lot of kids. So many kids I see come into clinic with complaining of tummy pain. You know, every day they'll complain they feel sore in the tummy or they feel sick. And more and more I'm seeing more and more kids with chronic constipation as well, or sneaky poos where they'll do a bit of a poo or maybe even get a bit of diarrhea, but they're not really clearing their bowel out properly. All of these symptoms can be associated with also having a leaky gut. Some of the causes of this gut wall inflammation can be stress, toxins, food particles such as gluten, certain medications, bad gut bugs. We're seeing a lot more kids with worms such as pinworms or threadworms and other gut bugs. Gut wall becomes inflamed, the gap between the cells open up, and that's when we see these complexes entering the system, triggering immune responses that we normally shouldn't see. So when someone comes to see me, a child comes to see me suffering from, say eczema to me is not necessarily a skin condition, it's an immune condition. And the big organ we associate with eczema often is the gut. So to treat someone's eczema, you really need to make sure that their gut's healthy and well, that they don't have leaky gut, that they don't have food intolerances. Asthma, again, we always look at the gut. So as you know, or as you probably realise, us naturopaths are all madly gut focused, but we call the gut the second brain. It's just so important with your child's whole health. Fatigue, skin rashes, in adults, autoimmune conditions, gas, bloating, even things like anxiety, autism, depression can all have an origin, all have a role that the gut plays in contributing to these conditions. So getting your child tested or checked to see if they have a leaky gut is a really good first protocol. And one of the ways that we can test to see if there is what we call gut wall inflammation is through doing a special blood test. Food allergy is the next thing that we'll talk about tonight, and it's really common in kids. Food allergies are, and most times you know if your child's got an allergy because the response is immediate. It can be an anaphylactic reaction where kids have trouble breathing, and 90% of food allergic reactions are to the foods listed here: cow's milk, egg, peanuts, tree nuts, shellfish. If you suspect your child has an actual allergy, you need to get them tested, but that's something your naturopath can help you coordinate as well. We want to rule out allergy. What I'm seeing a lot more of is what's called food intolerance. So most times patients don't come in, or kids don't come in wanting to know if they've got allergies. They've usually worked that out. What they want to know is if they've got food intolerances. Now, food intolerance is a different kettle of fish. It's what we call an IgG response. Food intolerance are tricky because they're not obvious. You don't eat, say you've got an intolerance to egg, you don't eat egg and immediately always feel unwell. They can be difficult to identify and they can build up over time. And it's often the foods that are eaten most frequently. So you might have some dairy one day, some wheat the next day, and then have an egg, and then get a migraine, or then your eczema might flare. So they can be a bit tricky to work out. Symptoms that can be associated with food intolerance, and again, strong correlation between food intolerance and leaky gut, because as the gut wall becomes inflamed, food particles larger than normal can cross into the bloodstream and trigger that inflammatory response. Fatigue, cravings, dark circles or bags under the eyes. Think about yourself while we're going through this list as well. Headaches, insomnia, autoimmune, yeast or candida, fluid retention, indigestion, leaky gut, sinus, constipation, the list goes on and on. So food intolerance is, I'm finding more and more, a massive contributor to why our kids' health is not what it should be. Facial symptoms, so have a look at the person next to you, and this is where we'll see kids that get that perioral, what's called perioral dermatitis, which is just means around the mouth, and that can be to things like eating strawberries, where they'll get a rash or a red ring around their mouth almost straight away. Chronic runny or congested nose, so these are our snotty kids that are always sniffling. The kids that get those dark rings or dark circles under the eyes always look like they're more fatigued. Pale face, and creases in the bottom eyelids. Red ears, and sometimes with kids it'll be one red ear. Red cheeks, line across the bridge of the nose where they're constantly sniffing and rubbing their nose. And the great news is there's two ways to work out what foods you can be intolerant to. One way is to do an extensive food elimination, like an elimination diet, where we cut out all the major reactive foods for a period of time, and then we test each food group, one group at a time, 1 week apart, to see what foods your child reacts to. A really great new thing that we've come in contact with is what's called the food detective food intolerance test. We do it in the clinic. It's just a pinprick, so it's not like the old food intolerance test where we'd have to draw blood, and it gives us a result usually within a couple of days, and it checks for 43 foods. So getting a food intolerance, if you suspect your child's got food intolerance, or if your child's got eczema, tummy pain, getting sick all the time, often what can happen is if your child's reacting to a certain food, it means while their immune system's busy with dairy, that they're then going to be getting sick all the time. So I had a child a little while back, came in and was getting sinus and hay fever and asthma, but it was also getting recurring ear infections all the time. We found out that this child had an intolerance to dairy. When we cut dairy out, the immune system shifted enough that the allergies subsided and the child stopped getting sick. So if your child's getting sick all the time, or getting eczema or hay fever or headaches or tummy aches, it could well be due to a food intolerance. This is a great place to start, because rather than not know, you'll get a list telling you exactly what foods we need to steer clear of. Just because we cut out foods that your child's intolerant to doesn't mean you have to avoid those foods forever. We can always trial them again down the track and see what your child can tolerate. But it's a great way to just fast track what is the best diet. Additives and preservatives, almost everything found in a can, packet or bottle, our body needs extra nutrients to detoxify, and they've been linked to all sorts of things: headaches and migraines, itchy skin, asthma, insomnia. One of my kids recently, the parents worked out that it was a preservative in their after school snack that was stopping them from getting to sleep of a night time. Stomach pain, again, anxiety, depression, forgetfulness and tiredness, ADD-like symptoms, even short temporal outbursts. So these are all conditions that can be linked to food additives and preservatives. And you know, you can buy books, there's lots of books out that you can read through and find out what all these chemicals are. But as my wife Dana always says, doesn't matter what they are, just really have it as a goal in the whole home that you don't eat anything with numbers in it. Nutritional deficiencies. And this is where we come up with the arguments of organic versus inorganic. You know, do we try and spend the extra money and get more organic fruit and veg? My thoughts are, this day and age, due to the extra stresses and pace of life, quality of our food, growing practice, etc., that even organic stuff, I'm a big fan that we definitely still need to supplement our kids as well. Our kids often have a highly processed diet and often a very restrictive diet as well. How many of you out there would say that, you know, you really have trouble getting your kids to eat what they should be eating? Now, the most common deficiencies that I would see are things like zinc. And this picture here has got a picture of someone's nails, and you probably can't see that, but there's white spots on the nails, and white spots on your fingernails are often an indication of a zinc deficiency. Now, what's interesting, Lee, is that often when you see white spots on your nail, they'll appear at roughly the same position on each of the nail. So this means that when that part of the nail was growing in the nail bed, your child's system was under stress. They might have been sick or unwell or had a bad patch for some reason, and their body was, you know, really using up their zinc store, so it showed up that they had a white spot at that time. And I think I'll go through these one at a time. Magnesium, another really common deficiency that I would see. And magnesium with kids really relates to their stress levels. Kids that get restless legs, kids that get leg cramps, kid that gets leg pain, kids that get headaches and migraines, kids that get the old-fashioned, what we used to call stomach migraines, generally all benefit from taking zinc. Vitamin D, you'd think in Australia, being the sunniest country in the world, that all our kids would have plenty of D, but we do the slip, slop and slap on them that much these days. So many more of our kids spend a lot of time indoors as well, that unfortunately they're not going to be getting the sun exposure that they really need. And when we talk about sun exposure, to make vitamin D, it's full torso, front and back. So yeah, it's a common deficiency amongst our kids. B vitamins play a big role with brain, mood, nervous system, concentration, focus. Iron, you know, kids that are deficient in iron is a really common deficiency, often because kids are too lazy to eat too much red meat. They don't like to chew sometimes. The IQ deficiency from a child being low in iron up to the age of 12 will never be picked up after that. So low iron can really play a big role with your kids' concentration and focus. And iodine as well. You know, kids aren't always great seafood eaters, and our soil's low in iodine. We need iodine for healthy thyroid and, again, healthy brain function as well. So easy to see how we can become deficient in a wide range of these nutrients. So if your child's ticklish, sensitive, gets muscle cramps, restless legs, trouble relaxing or going to sleep, that can indicate low magnesium and B vitamins. Bedwetting after the age of 5 can also be low magnesium and calcium. Poor dream recall, kids that dream a lot but can't remember any of their dreams, can be low B6. eczema, dry skin, poor concentration and fatigue, low essential fatty acids. And actually, one of the most exciting tests I've come across lately has been what's called the omega-3 index. So for the first time, fish oil makes such a difference with kids that have learning and behavioural issues. For the first time, through a simple pinprick, we can actually determine whether your child's level of omega-3 in their red blood cell membrane actually puts them into a healthy range or not, from a brain and concentration point of view. So rather than just take fish oil, we can actually test and see whether your kids need to be taking more fish oil. And white spots on the nails, zinc deficiency. And these were just a couple of studies. This was one showing the benefit of omega-3 fatty acids or fish oil improving symptoms of AD or ADHD. Zinc supplementation taken with like an ADD medication gave a much better outcome. Iron improved symptoms. And low serum magnesium levels shown in kids with ADHD correlated with symptoms they were experiencing as well. So these nutrients can also be taken or prescribed alongside conventional medication initially until we see enough of an improvement to maybe try and reduce those conventional medications, and again iodine supplementation. And then finally, number 6 is what we call the genetic polymorphisms. The old saying, and what I often say to parents, is when we talk about kids and kids' health, is that the apple never falls far from the tree. Now, usually if mum's in the room with me, dad or dad's family usually cops the blame for any genetic predispositions that mum thinks their child might have got from the father. And that may well be the case, to be fair as well. So the main one I'm going to talk about here today is what's called pyrrole disorder. Now, pyrrole disorder is a problem that some people have when they break down red blood cells. They produce a compound called pyrrole, which is neurotoxic, causes inflammation to the brain and nervous system. Elevated levels of pyrrole also contribute to a chronic zinc and B6 deficiency. So these often will be the kids with the white spots on their nails. Now, zinc and B6 is really important for the development of a whole arm of your child's stress coping system. So kids with pyrrole, I'll ask their mums how long have they been anxious for, and mum will say, oh, they were born anxious. You know, these are the kids that couldn't stand loud noises or couldn't stand bright lights. Affects up to 10% of kids, and we see it higher with conditions like autism, ADHD, also anxiety and depression. And in a class of 25 to 30 kids, it means that 2 to 3 kids won't be learning or behaving well. With pyrrole, we see emotional mood swings and anxiety, difficulty coping with stress. These kids have poor stress resilience. So just going to school and coping with school and trying to hold everything together is enough. They can't do a lot of after-school activities, or these are the kids that come home and then go crazy, you know, blow up at mum and siblings, where the teacher will say, no, they've been perfect all day. So that can be a sign of your kid may be having an issue with like pyrrole. Sensitivity to light and sound, pale skin, and they often have that bumpy, what's called keratosis pilaris, or bumpy goose flesh-like bumpy skin on their outer arms. And again, often have those white spots on their nails. So with pyrrole, there's questionnaires that you can fill out to see maybe, because if your child's got pyrrole, then either you, mum, or dad will have pyrrole also. So there's a simple questionnaire that we can send you out, or there's a really simple urine test. And correcting pyrrole is really simple. It's a zinc and B6 supplement that's really easy to take. It can sometimes be the turning key to your child, like just behaving and feeling so much better in themselves. So worthwhile considering. All right, so what to do about all of that? Healthy lifestyle habits for kids. So healthy foods for our kids. Diet's really the cornerstone to good health, and it's probably the hardest thing for mums and kids to really get into good patterns with. But we're particularly good as naturopaths in helping you work out what is the ideal diet for your child, but also giving you some tips and ways of how you can start to change your child's diet. The way to approach dietary change in a family is for the whole family to improve their diet. You know, all in one in. You know, it's really hard for you to be restricting a certain food in your kid's diet if they've got to look at it in the fridge every day you know, if it's milk or if everyone else is having normal bread or whatever. Additive and preservative free, as I've mentioned before, that's something you can start to do straight away, and there's plenty of alternatives. I guess the idea is to go back to, you know, fresh whole food that we prepare from scratch ourselves. Determining if your child has food intolerance or allergies definitely can fast track what is the ideal diet for your child, and then hence the whole family. And where you can, you know, organic foods. Or on our website, we do have a good blog where you can check out the Dirty Dozen. So these are the organic, or the top foods that have been sprayed a lot. Unfortunately, strawberries and blueberries are in the Dirty Dozen. So these two are amongst the most sprayed of our fruits. So where possible, or definitely try and get these organic. And the Clean 15 are the fruits and veg that are least likely to be sprayed, don't need to be sprayed, and you know, if you're going to spend your money on organic stuff, get the ones that we know are definitely well sprayed. And there's lots of different dietary approaches, but again, you know, we can look at like elimination diets if we don't do the food intolerance. There's the GAPS diet for kids that really are have a lot of severe symptoms. I'm a big fan of drinking filtered water and avoiding sugar, what I call the anti-nutrient. So back to water, like water's one of those things, like if you think about it, the only thing our kids should be drinking is water. What's absolutely critical is that you get a good quality water filter. You know, we're so fortunate that our water comes, you know, to our tap and we've got water at any time. But if you think about it this way, our water comes from Grahamstown Dam. That water has a lot of, you know, bacteria and toxins and chemicals. So for us to be able to drink it, it's got to be fairly heavily treated. And so it's a bit like swimming pool water. And unfortunately, the chemicals they put in to treat it don't get taken back out again. And some of our gut flora may be a bit sensitive to the chemicals in that water. So getting a good water filter. And sugar is just an evil, evil, evil substance for any of us, but particularly for our kids. I won't go too much into that, but one of the worst things we can give to our kids is a sugary breakfast cereal. You know, it gives them a spike in their blood sugar, so that come mid-morning they're having difficulty concentrating and focusing, and their behaviour could be all over the shop. So making sure our kids have a balanced protein, carb and fat breakfast, and just looking at how much sugar is in these food items. Now, when it comes to health, there's always a question around, you know, well, really, what do we do? Do we do more a drug type approach or more a natural approach? Or in some very valid cases, we'll do a combination of both. What's really important though, when we look at using natural medicine, is that the old saying is that quality really is what you pay for. You need to make sure that the supplements you're using, that they're the best quality, that they've been really thoroughly tested. We're very fortunate in Australia that we have a very strict TGA, so quality is really good. However, testing for companies saying what's in the supplement after the fact is not always very thoroughly governed. And we make sure with the supplements we use that we know that what's on the bottle is what that we're actually giving to that patient. And particularly that 12 months later, not that they should have their supplement 12 months later, but 12 months later we know that's still guaranteed that we've got the same therapeutic amount of the therapeutic doses that we need. Less excipients and fillers. So a lot of cheaper products on the market have a lot of extra packers in there that again aren't going to give you the benefits or the outcome. And therapeutic levels, to my mind, I was looking at an article recently comparing our echinacea to an echinacea you can buy on the shelf. There was 800 times more active ingredients in the quality echinacea we had compared to this one on the shelf, and it wasn't a lot less expensive than what we sell ours for. So when it comes to natural medicines, you do get what you pay for. And fish oil is a great example. You know, one of our fish oil capsules is the equivalent of about 4 of a competitor's fish oil capsule. And a good rule of thumb is if you open your fish oil jar up and it smells fishy, or if you try this, cut one of your fish oil capsules, if it's not one of ours, cut it with a pair of scissors and just have a smell of the oil or taste the oil. If it smells fishy or tastes fishy, that oil's already rancid, that's already gone off. So someone said to me the other day, well, can I give it to my dog? And I said, well, do you like your dog more or your kids more? And they said, well, I really like my dog more. And I said, well, don't give your dog that fish oil. And advice, when taking a natural medicine, remember that they are still medicines. Talk to your naturopath about any supplements or other medications you might be taking as well. But quality only. If you go down the path of trying natural medicines, see qualified practitioners that can prescribe therapeutic doses of the right range of exactly what you need. Now, when it comes to our kids' health, this year obviously there's a lot of stress, a lot of fear in the community about the coronavirus, and we know that this is a virus that currently is in the northern hemisphere, so which is their winter. So we know that as the flu virus sort of travels to the southern hemisphere, this coronavirus will start or has already started to come with us. And these viruses tend to thrive more in the cooler weather, which is why once the warmer weather comes, we'll probably see a lot less of a problem. And I'm hoping that's what happens up north, that once the temperature warms up, that we'll see that these outbreaks actually slow down, and that may influence us as well. With our kids' health, our kids do get sick more often now than what they used to. So kids more than anyone need really good practical tips on how to keep themselves germ-free. So encouraging our kids to wash their hands, encourage that, their environment, if they're unwell, don't send them to school. If there's kids in the class unwell, unfortunately it's getting to the point that, kids won't be able to go to school if there's other kids there who are unwell. So doing what we can to boost our kids' health is really, really important. I am a fan of taking a good quality multi for kids. We have a really good powder here, and depending on the age, we can adjust the powder up and down. It tastes fine, a little bit of juice, but it covers all their essential nutrients. I'm a big fan of fish oil for kids, and if you want to know how much, or if your kids need fish oil, we can always do the fish oil test. But fish oil, the multi contains your B vitamins, your minerals to help cope with stress. Your fish oils are anti-inflammatory, helps with concentration and brain health. And then getting onto a good quality probiotic, because one way we can really influence our kids. So say, for instance, if your kid's getting sick all the time, if we can work out that yes, dairy and say yeast are not good foods for your child, taking your child off those foods, getting them onto a probiotic, straight away your child's immune response or immune health is going to improve. Now, if we can also add in nutritionals such as Meta Zinc plus vitamin C, and I'll go into a specific immune boosting combination in a minute, but Meta Zinc and vitamin C, for me, zinc really helps viruses to stop replicate, and vitamin C really helps to just wake up all your immune cells, your white blood cells, and give you a much stronger immune response. So general maintenance for kids, I'd recommend something, a script or prescription somewhere along the lines of that. But probably for the current viral season, I believe every child should be on a zinc and vitamin C supplement, and again the dosage can be adjusted depending on your kid's age. We've got an amazing children's immune mix here, which has echinacea and a few other really good herbs. It's quite pleasant to taste, and again we can start off on 2.5 ml maybe as a preventative dose, but if your child gets sick, we can bump both of those up so that they can take the immune mix 2.5 ml 4 times a day, and the Meta Zinc and C, whatever dosage they're prescribed, up to 4 times a day. So not only are they preventative, but they can give us good scope to increase and actually help fight something if your child does get sick this season. The other thing we're recommending is a really great herbal throat spray as well, because this virus seems to start in the throat, often with a sore throat. Getting your kids used to taking a really good throat spray before they go to school, when they come home from school. So it's all about thinking about where your kid's going to become in contact with this virus, or any virus or cold or flu this year, and what you can do to minimize that risk. But as basic essentials, a script like that would be great. But we're seeing a lot of kids, a lot of parents come into the office using our herb bar, which I'll explain in a moment, and just getting some supplements to try and help really support their kids' immune systems. So how can we help your child? Firstly, identify the cause. Testing is really important. Work out if your child does have any nutritional deficiencies, if your child has food allergies. There's a consideration there to do the food intolerance test, to look at the gut health and liver stress. And there's also, we've got access to a wide range of stool tests if we really need to dig a lot deeper into working out your child's exact microbiome. Specialised dietary and lifestyle recommendations, as I mentioned, best quality nutritional supplements and natural medicines, and programs of care outlined. And us naturopaths basically are like your personal health coach. But keep in mind, if your child comes in to see one of our pracs, or generally I tend to see all the kids, anything I recommend for your child is going to benefit the whole family this season, particularly in keeping well. Where to from here? Buy organic when you can. Educate yourself. Learn as much as you can about your kids' health, about your kids' diet. Secret Mother's Business, that was a seminar that we're doing, but we'll come back to that later. Get onto our Facebook, Instagram and website. We've got a heap of information on our website. We're always putting posts on Facebook. We always have stuff on Instagram. So on our website, we have a heap of kid-friendly recipes as well. And there's so much more help available these days. If your child does have to go onto a restrictive diet for a period of time, we'll be able to point you in the right direction to know where to go and get the best recipes that the whole family are going to enjoy. And follow your intuition. You are your child's best expert. As I said, we share lots of resources. Check out our website for healthy blog recipes. And we'll also email you out tonight. For those of you attending, we'll email you out some information with a couple of good blogs about kids on there as well. But please get on and check out our website. Now, the Herb Bar is an exciting new venture we've got going on at Mullen Health. And what the Herb Bar is, basically it's a drop-in, a free drop-in centre within our reception area. We have fully qualified naturopaths working 6 mornings a week from 8:30 to 1. And basically they're there to offer free advice and prescribe quality natural medicines for you or your family. So if you want to come in and just talk to the Herb Bar girls, you can come in and they can make you up a mix for whatever's going on with you at the time, or they can get you set up to get all of your kids onto some natural medicines to take over the winter period. If you feel like your child has a more in-depth problem, or you'd like to come and have an appointment with me, then by all means take advantage of that $30 off voucher, and we can make an appointment. But if you've got any health questions, get in the swing of using the Herb Bar. Your grandparents, your parents can come in, your grandparents can come in, anyone can come in and receive really great value and great service and great free advice. Now, as this is a different format to what we've done before, we've never done an online event like this, and to be honest, it does feel kind of funny just talking to a computer, so I hope there are people actually out there listening. If you've enjoyed what we do, when we send out, like, as I said, a big part of what I'm passionate about is education. What really helps us to get our message out to the much broader community is if you give us a review on Facebook or on Google. And on the email that we'll send you out tomorrow, there'll actually be a link on there that you can click onto. And if you click on there, it will take you through to where you can put a review on. So please let me know, because I'd really like to know if this format is easier for people to be staying at home and listening to these videos. If you think it's been of value, then I'd love to hear some feedback from you, and it's something that we can then do for maybe some of our other topics as well. If you think the presentation, if the slides have been easy to see, if I've been easy enough to hear, I'd really appreciate your feedback. So thank you again for joining us tonight. I'm sorry that I didn't get to meet you all in person, but please, if you or your child is having health issues and you'd really like some help getting to the bottom of what is going on, please take advantage of this voucher. And as I said, we'll be sending you information tomorrow. If you'd like to make an appointment, please give the office a call, and the ladies there will be able to help you out. And I'm looking forward to seeing you all soon.